And welcome to my local Bunnings, the Bunnings at Underwood in Logan City. I'm so pleased to be here today with the Chief Health Officer, Dr. Jeanette Young, and the Mayor of Logan, Councillor Darren Power. Some good news in relation to COVID to begin with. There are 0 locally acquired cases in Queensland today. And that's another great result for Queensland. No community transmission in Queensland today. There are 3 overseas acquired cases, but they are all in hotel quarantine, so keeping Queensland safe again. And I want to thank Queenslanders for everything they're doing to follow the health advice and to keep themselves, their family and their communities safe. We've had now 71.73% of Queenslanders, so almost 72% of Queenslanders who've had their first dose of a COVID-19 vaccine, and we're now at 55.5% of Queenslanders double dosed. So we are moving in the right direction. There are some hotspots in Tasmania that have been declared, some local government areas that have been declared, and I'll let the Chief Health Officer talk a little bit more about that shortly. But so Queensland, you are doing so well. Let's continue to accelerate what we're doing when it comes to vaccination, which is why I'm so happy to be here at Bunnings today. You can see the people lining up to get their vaccine today, but they're also lining up to spend big in Bunnings today. And that's because we've been able to keep our economy open for so long. And that's had a really important benefit for the people of Queensland when it comes to jobs and economic activity, and I'll say a little bit more about that. But today the message is very clear. We're calling on Queenslanders to roll up to Bunnings, roll up your sleeve and get a vaccination. Grab a vax, grab a sausage, grab a snag and get a vaccination at Bunnings today and tomorrow around Queensland. This is a great initiative to take vaccines to the people, to make sure people, particularly in communities like Logan, where we need to accelerate the vaccination rate, it's a great initiative to take the vaccine to people so we can continue on our pathway to vaccination and making sure we can hit those targets of 70% and 80% as quickly as possible. We know with COVID running rife in New South Wales that it is only a matter of time as New South Wales opens up that the Delta variant will come to Queensland. We are in a race to beat Delta, and the single biggest way to beat Delta is to get a vaccination. And so we're calling on Queenslanders. The clock is ticking. We need to get vaccinated. So for the sake of your family, for the sake of your friends, for the sake of your neighbours, and for the sake of Queensland, please get vaccinated. Now, of course, because our economy's been open and we've been ensuring that businesses can trade around the state, we've seen a strong economic recovery for Queensland. And the final position for the state budget for 2020-2021, that's the financial year just completed on the 30th of June, that'll be released later in the month, but I wanted to give everyone a sneak peek today. At our budget last year in December, we projected the budget deficit for this financial year to be $8.6 billion. We revised that down in the budget that we handed down in June to $3.8 billion. And now I'm very pleased to say that the budget deficit for Queensland for the 2020-21 financial year is likely to come in around $1 billion. In fact, around $973 million. That's a fantastic result and the best result of all the big states in Australia, all the big East Coast states. And that's a consequence of the strength and the resilience and the confidence of Queenslanders, the confidence of Queenslanders to follow the health advice, to keep each other safe, and to keep our economy going. And I want to thank our businesses in particular who've been so active over the last 12 months. This is right through the heart of the pandemic, through the most difficult time of the pandemic. Queensland has been able to come out on top, and I want to thank everyone who's worked so hard to contribute to that fantastic outcome. And that outcome is going to benefit all Queenslanders. We know we're going into a cyclone season and a storm season where we're likely to get a higher than average number of cyclones in Queensland. Remember, Cyclone Debbie cost this state $1.5 billion. The monsoonal rain event that happened in Townsville and the north and northwest of our state cost the same amount. So we need to be ready for that, and this outcome gives us the buffer that we need, the headroom that we need to protect ourselves for anything unforeseen in the future. So the message today, to avoid lockdowns, to avoid restricting economic activity and to retain the freedoms we have, is to get vaccinated. So please, tell your family, tell your friends, tell your neighbours, tell your mates, let's get vaccinated, and you can get vaccinated this weekend at Bunnings. I might hand over to the Chief Health Officer to say a few words, and then also the Mayor. Thanks, Dr Young.
Thank you very much, Treasurer. So yes, excellent news for Queensland today. 3 new cases, all 3 of them detected in hotel quarantine. All 3 acquired their infections overseas. 2 of them acquired them in Los Angeles. So some good testing numbers, but please, anyone with any symptoms at all, it's more critical than ever to come forward and immediately get tested, because we all know we want to find that first case in a cluster so we can immediately manage it and minimise any ongoing requirements. Now, Tasmania has declared that 12 of their LGAs in Hobart and South Tasmania went into lockdown at 6 p.m. last night. So Queensland will require anyone who's been in any of those 12 LGAs, if they arrive after 1 a.m. tomorrow morning, Sunday morning, they'll need to go into hotel quarantine. And I strongly recommend that at this point in time, anyone who is planning to go down to Tasmania, just reconsider whether it's necessary to do so right at the moment. So they haven't seen any community transmission at this stage down there, but they did have a person who was infectious out in the community for 18 hours over the 11th and 12th of October. So anyone in Queensland today who was in Tasmania from the 11th of October onwards, can you please just monitor for any symptoms? And if you get any symptoms, no matter how mild, immediately come forward and get tested. Now, there are some exposure sites that Tasmania's already declared, so if you've been in any of those exposure sites on the 11th or the 12th of October, please immediately get tested and isolate yourself till you get a negative result. So if you were on the Jetstar JQ715 flight from Melbourne to Hobart, arriving into Hobart at 8:27 p.m. on October the 11th, if you were at the Hobart Airport between 8:54 p.m. and 10:07 p.m. on that 11th of October, or if you're at Woolworths Bridgewater between 3:30 and 4 p.m. on October the 12th. Now, of course, all of this information is on our website and will go out in a press release. And please keep on checking, because there may be more exposure sites listed as we go forward. Now, the most important thing every single Queenslander needs to do this weekend, and no excuses, is to get vaccinated. If you haven't had your first dose of a vaccine, 12 years of age or older, please, this weekend's the weekend to do it. So we've got 33 Bunnings sites open across the state. Go there. We've got a multitude of mass vaccination sites. There are pharmacies and there are GPs. So it's really, really, really important, because we know if we've got high vaccination rates in our community, when the virus first infiltrates, we'll be fine. We've seen that happen. In New South Wales, they only had 4% of their community vaccinated when the virus infiltrated, and you can see what happened. Victoria's done much better because their vaccine rates were higher. I want our vaccine rates to be the highest ever, so that when the virus infiltrates, we'll do fine. We'll be able to manage it. Our hospitals will be able to manage the best care for any case, but they can only do that if there are lower numbers of cases, and the way to prevent cases is to be vaccinated. So this weekend, as I'm going to do, I've had my 2 doses, but I'm still going to go and have a sausage. I'll wait in queues so I don't stop anyone getting vaccinated having a sausage. It's really, really, really important. So come to one of those 33 Bunnings, go to a pharmacy, go to a GP, go to one of our mass vaccination centres. We have got plenty of vaccine and plenty of capacity. Thank you.
Good morning, Darren Powell, Mayor of Logan. I acknowledge that Logan is dragging the chain. Our vaccination rates are quite low and I'm quite concerned about it. The state government has helped us out and we're working with the state government. We've provided the Logan Entertainment Centre and the indoor sports centre at Mount Warren Park. As you can see, we're at Bunnings here and there's 3 Bunnings operating: Underwood, Browns Plains and Bethania. We've run out of excuses in Logan. People are going to have to get up their backsides and get out there and get vaccinated. I'm deeply concerned. Obviously, there's a lot of construction happening at Logan Hospital. I don't want to see, when it all opens up, Logan Hospital under a lot of pressure. So please, Logan residents, get your backsides into a Bunnings or to the Entertainment Centre or the Indoor Sports Centre at Mount Warren Park and get vaccinated. Thank you.
Treasurer, Dr. Young had some very strong commentary today, which said that it's a matter of time until all Queenslanders get COVID, but the double jabs would, not get us sick. So it goes a long way to suggest an outbreak will happen here in Queensland. A tweet put forward by the Premier yesterday, comparing what New South Wales, Victoria can do compared to what Queensland can do at the moment. If there is an outbreak here in Warrenstrife, do you think a tweet like that is kicking sand in the face of people that are struggling?
No, not at all. I think the Premier's made it clear. We are fighting to retain our freedoms, not regain our freedoms. And that's a situation in places like New South Wales that has faced 3 months of lockdown, 4 months I should say, of lockdown. More than 100 days, around 107 days. So for us, we need to work hard to retain the freedoms, to have an open economy, to have people moving freely in the community, to be able to spend time with our families and friends at our homes, at social events, at sporting events. We have to work hard to do that. And the way to do that is to get vaccinated. That is the beginning, the middle and the end. We have to get vaccinated, and everything we can do, including these pop-up vaccination centres at Bunnings this weekend across Queensland, is a great way for people to get vaccinated.
Taken back by the announcement yesterday by New South Wales that they're opening to the world. A lot of senior cabinet ministers have said that they received the news via text message. It must sort of, I guess it fuels the reluctancy again, doesn't it, now that you don't have any clarity around this plan?
Well, we're often asked about the roadmap to recovery in Queensland. Someone should ask the New South Wales government, what's the roadmap to visiting Newcastle? They can't even travel, if you live in Sydney, to your own state. It seems like, to me, it's more likely that you'll be able to travel to Bali than Byron Bay if you live in Sydney. So, look, our focus is on keeping Queensland safe, doing the work we need to do to project forward on the way forward, and also looking very carefully with the advice of the Chief Health Officer of what's happening in New South Wales and Victoria, calibrating that carefully. We're doing everything we can to give confidence to the Queensland community and to businesses, but we're going so well as a state. But the answer to all of this is to get vaccinated, and that's what we need people to do this weekend, every day and every weekend going forward, to keep ourselves safe, our economy open, and Queensland one of the strongest places and safest places to live in the country. Look, I think we all know that in areas like Logan and also in regional parts of our state, we need to lift the vaccination rate. That's just the reality. But I know Queenslanders are up for that challenge. It's why these Bunnings are available and open across Queensland today and tomorrow. It's so easy and convenient. It doesn't matter whether it's Bunnings, whether it's a state vaccination clinic like the one at the Logan Entertainment Centre just down on Wembley Road, whether it's those other clinics, whether it's your GP, whether it's a pharmacist now. There's ready supply of vaccine. Please do the right thing for yourself, your family and your friends and get vaccinated.
It's always been a secret though that vaccines are available. Vaccine is the way out of this pandemic. Vaccine is the only answer. Is it concerning though that you don't think that there are people out there who will not put together not together?
Look, I know Queenslanders are up for the challenge. We have kept this state safe. Queenslanders have followed the health advice, and that's the clear health advice now. Please get vaccinated, because that's the way we can maintain and retain the freedoms we have.
When will the state government be releasing the roadmap?
Look, we're working very hard on that, and of course we're considering what's happening in other states every day. But we've had a bit of a curveball yesterday, this announcement by the New South Wales government that it seems the Prime Minister didn't know about, and from what I'm hearing this morning, some of his cabinet colleagues didn't even know about. So we need to be clear and direct in our advice. That's what we've done to Queensland, for Queensland every step of the way. Queenslanders know very clearly what we're doing. We're working very hard, and we're going to continue to do that all the way through the pandemic and beyond.
Does the government have a date or an anticipated date to release that roadmap?
We're working very hard on what the future looks like for Queensland, but we're obviously monitoring very carefully what's happening in New South Wales and Victoria. We're seeing a real-time experiment in New South Wales. We're watching that very carefully, but we're not going to take a backward step in Queensland. We don't want to go backwards. We want to keep our people safe, and that's the work that we're doing at the moment, both on a health and economic front.
Has the Prime Minister lost control, do you think? I mean, he was talking about home quarantine just 2 weeks ago, and now you've got the New South Wales Premier talking about no quarantine. So has the Prime Minister lost control there?
Well, I think what we need are consistent and clear messages to the people of Queensland and to the people of Australia. I'm not going to get into the relationship between New South Wales and the federal government. We work very closely with the federal government, but our primary responsibility is to keep Queensland safe, to keep our economy open. You just heard this week, we created 1,000 jobs each and every day, all the way through the month of September. 140,000 jobs were lost across the country. We created 30,000 jobs since March. Not only have we created more jobs in Queensland than any other state, we've created more jobs than all states combined. And that's because we've kept our people safe. Queenslanders have responded with confidence to put money into the economy, and that's our story. That's the Queensland way, and we want that to continue in the future.
Obviously yesterday's announcement, I'm pretty sure you were in a press conference when you found out, taken aback by it. Just now the road map in Queensland looks significantly different than New South Wales has now gone road.
No, because the principles are the same. The principle is that we want to get everyone vaccinated, and once that happens, we know we'll have cases here in Queensland. They will come in. As long as everyone's vaccinated, that won't be an issue. So no, the principle hasn't changed.
So it's not a major concern.
No.
Like 319 cases today.
No. It's good to see their case numbers are coming down. What we'll need to do now is, as New South Wales opens up, which they can do because they've got high vaccination rates, we'll then watch and see what happens as a consequence of that. So that's to our benefit here in Queensland. We'll be able to see what is happening in another state as they change their parameters. But we know that the most important thing to do, and we're not going to be able to open up and remove all restrictions until we've got very high vaccine rates. And they've got to be high across our whole state. Queensland is a very, very different state to most other states and territories in Australia, in that we have a lot of people in regional and remote areas of Queensland. So we need to make sure that our entire state gets vaccinated. It just depends on what's happening. I'm hoping with these boosts, with these pop-up clinics, we'll be able to get there a bit quicker. So really the time at which we'll reach that 70% and 80% depends on Queenslanders. Every single Queenslander, 12 years of age or older, the quicker they come forward and get vaccinated, of course, the quicker we'll reach those targets.
Trevor, sorry, can I ask you a question? You spoke about the importance of getting the jab for the Queensland economy, but what do you say to those people who are working in the tourist industry? I mean, we have no certainty about when we can welcome interstate tourists to our state.
Well, there's no doubt that it's been very tough for some sectors of the economy, no question, including the tourism industry, and that's why we put in together a $600 million package for support for those businesses with the federal government, and that was the right thing to do. But can I tell you, the roadmap begins and ends in the same place, and that's vaccination. And so all communities in Queensland, and in fact all business and industry groups, should be promoting vaccination every step of the way. That's our way through this. We know that we are doing so well compared to other parts of the country, and to retain our freedoms, we need to get vaccinated. And that's the most critically important thing every Queenslander can do, for the sake of our business, for the sake of our health, for the sake of our family, and for the sake of Queensland.
House prices in Queensland are going up, particularly in the southeast. What would be your advice to people wanting to get into
sorry, to...
House prices across Queensland just keep going up. What would be your advice to people wanting to get into the housing market?
My advice? Oh, well, everyone makes a decision about their own housing choices, whether it be in a home, a unit. You know, that's the choice for every individual.
But do you think it's hard?
Yes.
So close to Christmas, can you understand the frustration though without a day, without a vote, weeks out of Christmas?
No, because I think Queenslanders know that being safe is the way to keep our economy strong, to keep people in employment. And we've seen employment growth in Queensland. The overwhelming majority of that employment was full-time employment too. And to keep ourselves healthy. But we're working very hard on that. We're following the national plan, can I say? And the national plan, of course, targets stages around 70% and 80% of vaccination. So getting to 70% is very important. We're at 70% first dose, so making sure we close that gap on double dose and then get to 80%. So we're following the national plan. We'll continue to do that, and of course we'll continue to do work both on an economic front, treasury front, and in a health front to work out what the next stages look like for Queensland.
On home quarantine, I'm just going to move on. It's a long question, and I apologise in advance.
That's all right.
I'm going to give you some background. So we've been approached from someone who's sitting in the area who was invited by HQ to do home quarantine, even though they live in Tembury Mountain, and they're technically closer to Brisbane Airport than those to the Gold Coast, but it's not included as part of the home quarantine program. Is that just an oversight that will be corrected, or is that something that's been specifically...
Look, I don't have the details on that particular case, but I might let Dr. Young talk about home quarantine more specifically to give you an idea of where we are with that important trial that is proceeding positively in Queensland at the moment.
Before you do hand over, can we do the flying taxis before we head so you
Sure.
don't have to come back? I don't know.
I'm always happy to come back.
Flying taxis. Would you like to see them towards the Olympics? There's a bloke screwing them at the moment.
Well, this is a long way off, but it could revolutionise how people travel in Queensland. So we will work, obviously, with the federal government. There'd have to be a lot of changes to our transport regulations, but we welcome innovation in Queensland because we are the innovation state. And we'd have to get the safety mechanisms right. We'd have to get of course, the transport regulation and aviation regulations right. But, you know, I know in my own community here in Logan, we're the home of innovation. We've got Go One here, a great Queensland company that's selling expertise to the world. We've got the Wing delivery service that's happening in our community here. We embrace innovation in cities like Logan. So this could be an exciting prospect. We always welcome innovation to create jobs, economic activity, and to make life better for people. So we look forward to these ideas coming to Queensland because they know that Queensland's a place that's open to ideas and innovation. I'd hand over to Dr. Young.
Right. So as of yesterday, 344 people had arrived in Queensland as part of that home quarantine trial. And as of Thursday, next week, the 21st of October, 998 people are booked in. Now that trial was for 1,000 people, so we're nearly at there. So we'll be immediately reviewing the trial and issues as you've raised about people who aren't in the area that the trial could happen. We'll be looking at what we can do to make it safe so we can expand that trial to broader areas. So it's a very important issue and it's something we're looking at. We wanted to start the trial with 1,000 people in the safest way possible, so that's why those initial 1,000 were chosen. But once we've looked at all of the issues and we've got all of that feedback, and we'll do it very, very quickly, we've been doing it as we've been going along, then we'll look at how we can safely expand it.
And by expanding, you expect that to include more parts of regions?
Of course, absolutely, yes.
Sorry. Do you think Wellcamp will still be used this time next year?
Yes,
For quarantine?
for all sorts of purposes, but particularly for quarantine.
Treasurer, mustard and tomato sauce on the snack for you, mate, or onions? What is it?
I just had 2 sausages down at Logan Brothers, so I'm doing my bit for the meat and butchers of Queensland today.
Hang on, you dodged it. Go on. How do you put it
I like sausage. Look, my dad was a butcher, all right? So I'll eat anything, anytime, anywhere. But I've just had my snags down at Logan Brothers.
Are you going to have a Thursday?
Not today.
Thank you all very much.
Thanks, everyone.